Nicole Smith Holt had to bury her son Alec, who was only 26 years old, because he passed away from diabetic complications, simply because he could not afford his insulin costs. His deductible for insurance was $7,000, and the medications that he needed was $1,300. He could not afford either one. This is the case for many diabetics in America. With a rising insulin cost, the mortality rate of diabetics are rising as well. According to the American Diabetic Association, diabetes is the seventh leading cause of death in the U.S. That's 1.6 million people. CBS and other media outlets have covered the stories of Shane Patrick Boyle, who died from diabetic complications after not having $50 out of the $750 that he needed to cover his insulin costs. And stories such as Nicole Smith's Holt son, Alec. Insulin is a necessity for type 1 diabetes. Type 1 diabetics' body do not produce insulin, which is what is needed to control the blood glucose levels. Insulin is also used for type 2 diabetics whose diabetes are high and uncontrolled. Lowering the cost of insulin could reduce the mortality rate, saving families the pain and suffering of having to bury their loved ones simply because they cannot afford the medications that they need to control their illnesses. Complications that could be otherwise avoided. The three most popular insulin meds run from $421 to $550, and that is depending on the units needed daily. As the mortality rate seems to rise with the rising cost of insulin, I think it's safe to say that we need to work on lowering the cost of this type of medication. Medications that are needed to sustain life, medications that are needed to ensure that a person can live a normal and healthy life despite having an illness, are medications that should not be too expensive for people to afford. Not everyone can afford health care. And I understand that this medication is very high demand, considering that the amount of cases and the many cases that are presented in the U.S. every year. However, if we can decrease the mortality rate for diabetics by simply lowering the cost of insulin, I think that that is worth a chance in giving these people a fighting chance to live and extend their lives longer than the years of 26 years old or even younger because they simply cannot afford the medications. To know that someone is dying and it is a death that can be avoided if only they had the medication that they need is worth fighting for. I'm trying to convince you that we need to fight to lower the cost of insulin medications, and not just insulin medications, but all medications that are needed for sustaining life. When you have certain diseases and certain ailments, you need medication in order to live longer, to try to live as normal of a life as possible, and to above all, avoid healthcare complications that could be otherwise avoided by just simply having the medication. By lowering these costs, we not only lower the mortality rate, but we also can reduce the rate of hospital and medical expenses that the U.S. spends every year. I have got a few different numbers when I was researching, but I can tell you that it's billions of dollars that we're spending just in diabetic medical costs alone. If we can provide our patients with affordable insulin, we can not only lower the mortality rate and save families from the pain and suffering, we can also save our patients from suffering and having shorter lifespans than if they just would simply have the medication. Type 1 and type 2 diabetics should equally have access to affordable insulin and diabetic medications as needed. With these things, they are able to live a longer, more prosperous life, and they may actually be encouraged to live healthier lives. So I'm hoping that you take this information and the stories that I have given you and consider that we need to actively fight for the cost of lowering insulin costs.